Hello, hello. My name is Rain Hankey-Ledwith. I'm a prevention specialist for IPS South Bay. This is our first time doing a Facebook Live series, so you let me know how it's going in the comments. I want to emphasize that this series is about centering resiliency or community strength. So what are some of the uplifting things that have happened during COVID or in relation to the opioid crisis? What are some things that personally and individually are helping us cope with some of these really challenging circumstances? Generally, just increasing community awareness about opioids, what opioids are, what the harm is from opioids, and their misuse.
Allyson, do you want to introduce yourself a little bit?
Yeah, so my name's Allyson. I am a licensed therapist based in San Diego, California. I currently specialize in working with people with eating disorders, body image issues, trauma, and anxiety. I also have a lot of experience working with substance abuse, so it's definitely near and dear to my heart. To me, resiliency is about courage, persistence, so like these individual kind of factors, but also about community and access to resources. Overall, resiliency is kind of like falling down 3 times, but getting up 4, having fear, and really doing the hard thing anyways. That would be kind of my basic definition of resiliency. Speaking about, systems of oppression that kind of make resiliency a lot harder or even impossible for some people, I think on the kind of community, larger macro level, we definitely need accountability, right? We need these systems of oppression to dismantle in order for everyone to have a chance at a full and healthy life. What I've seen with a lot of clients is that we use things to meet our needs when we don't have access to maybe like the society's accepted version of that need. I just want to emphasize staying connected to your why. We can find any way to get through something if we really stay connected to a small sense of purpose. And it doesn't have to be something big or grand, like I said, but just something. So I think I want to leave everyone with that.
This series is part of an effort to reduce stigma around talking about opioids, share information and resources. So I will be linking a bunch of resources in the comments after this video is posted. And feel free to make any comments or questions, and we can try to answer as best as we can.
My name is Stelle Andrade, and I'm the Community and Youth Organizer at the Institute for Public Strategies, specifically in the South Bay region. A little bit about me: I'm from Chula Vista, so working at IPS and working in the South Bay region is a real big privilege for me. As a community and youth organizer, I work with high school students to promote healthy, safe, and thriving communities, and we do that through the IPS lens of health equity. And we also work with community coalitions and other organizations in the South Bay and countywide to advocate for health equity and to talk about ways to prevent underage drinking and binge drinking and use of other drugs and other ways that we can team up together to achieve a common goal.
I think that there is definitely less stigma, less and less as the years go on, around talking about substance use disorders and opioids, and I think that's an overall really great trend because we can't take care of the problem until we talk about it.
I was given the opportunity to be able to come up with a project for the youth, and this was kind of after some brainstorming with IPS staff as well. And what we came up with was the idea of distributing flyers to the local pharmacies in the Lemon Grove, Spring Valley area. And on the flyers, it was a repeat of the Take Back Day flyers, but a more condensed version and a more kind of visually appealing way, where on the front it was kind of reminding them that Take Back Day was coming up, and then on the back it had East County specific locations for people to drop off their prescription drugs. During my time at IPS, I've learned the importance of resiliency not just at the individual level, but also at the community level. So in other words, how can we help communities and residents to overcome community trauma, such as health disparities, social injustices, and more, and really making sure we just don't ask communities what their problems are and how to fix it, but how we can collaborate with them and with other organizations to find solutions to these generational problems. Yeah. I said it's not a cookie cutter solution for every single person, which I think is kind of a fine line that some people who have good intentions accidentally walk because they want to help communities and help people, but not every person is the same. So just kind of making sure that we help people and meet them where they're at a more equitable lens.
Thank you so much for having me. My name is Alexis Sanchez. My pronouns are she, her, and hers. I'm an assistant program manager for the Institute for Public Strategies up here in Los Angeles. So I oversee one of our projects in West Hollywood that seeks to move the LGBTQ community in West Hollywood away from binge drinking and problem drug use. Those parts of the LGBTQ community that have intersecting marginalized identities, people who are Black, people who are women, or who are trans or non-binary, just have to deal with not only the stigma that comes with being LGBTQ, but having to deal with systemic racism and systemic homophobia, transphobia. So in the face of those things, I think those marginalized communities had to build a lot of resiliency and just, find ways to express themselves through art and find ways to organize within their communities and create networks of mutual aid and find ways to help people get access to medical services when they aren't accessible to people, who may be undocumented or people who might, have official documents that don't match their identity. So I think resiliency is something that exists throughout the LGBTQ community, but something the more marginalized a group gets, the more that they have to really develop and build that. It starts with really acknowledging privilege and getting to know the differing systems of oppression, because building resiliency for communities of color is going to be different than building resiliency for white communities. And again, I always try to make sure that everything I do is culturally humble, not only culturally competent, but really appealing to people and meeting them where they're at. I long for the day when the communities that I organize for, especially the more marginalized ones, like the undocumented trans community or the Black trans community, has access to the same things that their cisgender, gay, white, male counterparts in the community have. We have a couple of things that we're working on from media messaging campaigns and working with the city of West Hollywood to kind of raise awareness about what chemsex is and what that looks like and what the dangers are, short-term and long-term. And then trying to also pressure the apps themselves. Our community coalition is working on we're working with Grindr, which is the premier. It's the I'm not going to call it the number one, but it's one of the most well-known apps that people use. But we're working on a campaign to pressure them to have substance abuse counselors basically on demand, so that if someone is using the app and they get triggered by someone who's using emojis that indicate meth or wanting to hook up, they can just press a button and go into chat with a substance abuse counselor. Pre-pandemic, we were setting up at places like Pride and Halloween and places where we could get a lot of foot traffic of people who are potentially going to be using substances later, and trying to just inform them, say hey, just so you know, sometimes these things can be contaminated. Here's how you protect yourself from that, and here's what happens if you do experience an overdose. So the thing that I want to close with is I hope that everyone is taking care of themselves and finding self-care where they can. I work really hard, but I also make sure to take the time to disconnect from things where I can.
Sure. My name is Marcus Bush, and I was just recently elected here in National City, my hometown. I grew up here in National City and just won my election, so I made history as the first Afro-Latino, tied for first millennial, along with Vice Mayor Rodriguez in our city. And then in the first openly LGBTQ elected from National City. And so I'm really honored and excited to be here. We have a lot of challenges in National City, and I'm really excited to be working with our mayor and our new council on solving those challenges. So yeah, it's exciting to be here, and I'm happy to have this discussion. You think about voter participation, I think that's an indication. It's just one tool, right? Because it doesn't into account undocumented community immigrants or people that just are too young to register to vote or just aren't registered. So, but it's one indication, right? Engagement at council meetings is another. So it's those are just a couple of examples. It's an empowered community and empowered citizens that like have a voice, that are proposing policy, that are involved with the community, volunteering, making changes, and just grassroots and having creative ideas, being innovative, but having it from the community. To me, that's where that power is. I had been involved in the community a long time. I guess what interested me in the politics side of it, because I was always grounded in the city planning side, but the politics side, and there's politics in everything, right? Anything. I don't care if it's like science or health or whatever it is. Politics, at the end of the day, is about is the distribution of power. Because you thought, the theme resiliency, it just brings up that point that I think like that's resiliency, like investing in the next generation. Like I'm here today where I am because of my ancestors. Like I think of what resiliency means to me. And I think of resiliency, a lot of it is investing in the next generation and like coming from your ancestors. Leave folks with anyone, it's just getting involved in the community and in the city, right? In the budget, probably everything, it's budget. Like, and it's complex and there's tons of nuance to it and finance and all that. But it's so important that we start reimagining how we're spending our resources and what's efficient, what's effective, and what's not. So that's probably what I'd leave with in terms of, I guess, a call to action.
Hi everybody, and thanks Rain for this. Is really exciting. Been watching you do your live Stronger Together series, and it's been really good, and I appreciate being on here. I am the program manager for the South Bay, the Institute for Public Strategies, and we work in all of the South Bay communities from National City, Chula Vista, Imperial Beach, San Isidro, Coronado, and Otay, all on a lot of preventing underage drinking initiatives, just keeping youth, the access away from drugs and alcohol. There's a whole lot more to it, advocacy, policy, media, working with law enforcement, elected officials, and all for the benefit of the community and our youth. Resiliency is coming back to where we were and being able to bounce back. I was a community organizer. Yeah. I hated the summers because I loved school so much, and when it was summer, we couldn't go back to school. So I would organize the community and all the kids in the block. Coming to and have pretend school in my garage. we'd have as garage sales. I'd organize races around, with their bikes or skateboards. Always something to make sure that we were not just sitting around, and made sure that everybody was involved and we were doing things. I didn't want to just sit in my room and in my house and watch TV. What inspires me is when we can help our community. It's like, okay, we heard you and let's work on it, and let's work on it together.